Hi YouTube friends, it's Kate. I haven't made a video in a long time. Of course you wouldn't know that because I haven't yet posted the first video at the time of me recording this. Yeah, it's kind of been a crazy roller coaster of a first trimester. I'm in my second trimester now, but I thought I would kind of finish up. My last video ended at 7 weeks, so I'm gonna talk 7 weeks till the end of the first trimester. And hopefully I can remember everything, but it just has been insane and I've been so tired and I hadn't felt like making a video even though I knew that I should to document everything, but it didn't happen. So, okay, here we go from 7 weeks to the end of the first trimester. That last video I made, if you haven't watched it, go watch that one first. I was at exactly 7 weeks when I made it, and the following day I had an ultrasound um, with my regular OB, and that night, that Thursday night at 7 weeks, when my husband came home, he said that he may have been exposed to COVID at work. I'm just like, oh great. So the next morning, we were kind of like torn what to do. So that night, I had him quarantined to our guest bedroom and we just stayed apart and just to see if any symptoms developed and all of that. So that Friday, when I was scheduled for my ultrasound, my husband had that day off and I was torn like what to do because I had so much anxiety over the ultrasound and I really wanted someone to be there, specifically my husband, because it would be the first time that we got to see the baby on the ultrasound screen because like I said in that last video when I was in the hospital, they didn't let you see anything. Friday morning came and he had no symptoms. He was feeling good. Of course, I was feeling good. We'd been separated, so I said, since you don't have symptoms, like, let's go. So, we wore masks and all that. And the ultrasound went fine. The hematomas that I had, one seemed to clear up completely with the, like, I guess, modified bed rest that they had me on. And then the other one, she just said, was really small and wasn't too concerned about it. And again, I didn't have any bleeding, so that was reassuring. But the ultrasound looked really good. Saturday morning, um, my husband was still feeling fine, and per his work's protocol, if you don't have symptoms, you're supposed to go in. So he went in and then came home from work, and he was feeling pretty crummy. And I was like, well, you've got to stay in the guest room. So then, of course, I was freaking out because here I was 7 weeks pregnant, just petrified of what was going to happen. Long story short, I did not end up getting COVID. My husband did, but it was really, really mild. But we did stay separated. I had another appointment at 8 weeks. So for that whole week, we were separated. He stayed in the guest room and I stayed in our bedroom. And I was able to go to my 8 week appointment because I tested negative. So I went to my 8 week appointment with my doctor, and I wish that my husband could have been there, but it is what it is. And the baby, looked good on the ultrasound. It was just a really routine kind of 8 week appointment. I was really nervous when she walked in and she was like, "How are you doing?" And I just looked like a deer in headlights. I was like, I'm just so, so nervous. And after that appointment, I decided to go stay with a friend so that my husband could not have to be cooped up in that one little bedroom for the next 10 days. And even though he was in that, it's kind of hard to explain, guys. Our guest room, which will eventually become the baby's room, has a sliding barn door. And for some reason, I don't know, I just felt like since the door was sliding, I don't know, it didn't feel secure, like it was gonna keep the COVID out or something. So I was staying in our master bedroom, which is on the complete opposite end of the house. And so each one of us were like quarantined to these rooms, and I was losing my mind. So it's like, okay, I've got to go. I'm gonna go stay with a friend. So I went and stayed with my friend who lives about an hour away for I think 4 days, and my husband was starting to, feel better that following Sunday, and I was like, "Well, I kinda would feel better being closer. I think I'm gonna go stay with my dad for a night, and then his quarantine to be over." So, I wasn't really ready to tell my dad and his wife about the pregnancy, but it was a little difficult to explain that otherwise. So I did have to tell them, and they're so like nonchalant about the whole thing. And so I stayed with my dad one night in my stepbrother's old room, who's in college now, and there's a fish tank in there that kept me up all night. Like I could not sleep because that stupid fish tank. And I just told my dad, I was like, I'm either about ready to go home or I'm gonna have to get a hotel. And his wife, who is a nurse, is like, you've done so much to avoid getting sick, like I wouldn't go home yet. So I ended up after that staying with her parents for 3 nights, I think, and then finally Alex's met the criteria like his symptoms. So his quarantine ended up going to 12 days, and it was so frustrating because his symptoms weren't like super severe, but he had them, and so just like waiting for these to go away so that I could come home, and then of course come home and like clean and sanitize everything and all of that, and I was fine. Like I didn't get COVID. He survived the COVID. It was no big deal. So that was in early October from like my 7 week till basically like 9 week mark. It was just a mess. So that was the most eventful. What I can kind of say from like um, there on out at 10 weeks, I ended up having a pretty bad UTI. And when I was in the ER at 6 weeks, they had found some bacteria in my urine and they put me on like macrobid or something. And I took that. And then I had to go like get another pee sample. And I don't know if the macrobid didn't clear it up or if I got another UTI. I have no clue. So then they put me on amoxicillin. I took that. And then I went in at 10 weeks and decided to do the genetic testing because I really wanted to find out the sex of the baby. I never really was into that with my last pregnancy, and I don't, the sex wouldn't matter to us either way. But I felt like I was so disconnected from this pregnancy, and I felt like by finding out the sex, it would just, I don't know, give me something a little bit more to connect with this child. I don't know if that sounds weird to some people or if you guys can understand that, having gone through loss before. So when I was at that 10-week appointment to get my blood drawn for the genetic testing, the nurse said, you need to do a urine sample. And I was so confused because I was just there to get a blood draw. And I said, oh, it must be because I finished an antibiotic and they want to check and make sure. So they did a urine culture. And a couple days later, I get a call that says, we found bacteria in your urine. So again, I don't know if those antibiotics didn't clear it up or what, but they did a urine culture that third time and then prescribed Keflex, which was supposed to clear it. So I was on that as well. So I was a little irritated because I was on 3 antibiotics already and I was only 10 weeks pregnant. So during that 10-week mark, it was like 10 weeks and 4 days when they put me on the Keflex. Well, the next day I was still having pretty bad like symptoms. Like I had flank pain, I had groin pain on both sides. I was really concerned and I was feeling kind of like twinges kind of in my abdomen. And of course, it's like all like your bladder and everything is like all kind of in that lower pelvis area. So I was freaking out. And my first early miscarriage, I had back pain that started. So anytime I get back pain, I'm like freaking out that something's wrong. And I was still so early in my pregnancy. So I called my doctor's office that Tuesday, 10 weeks, 5 days now, and told them, I was still having these symptoms, and I really would like to be seen. And like I love my doctor's practice so much because anytime I've ever said I want to be seen, they've always got me in that day. Now it's not necessarily with my doctor, but it's with a doctor. So I saw their on-call doctor that day, like 2 hours after I called them. So I went at like 10 o'clock, and she did like a pelvic exam, and she did like a little ultrasound. I don't know, those things are like that big, and she did that just so I could see the baby and kind of reassure me. But she felt like all the symptoms I was experiencing was due to the UTI. So I was like, okay, so they tell me to keep taking the stuff, and in a few days I should feel better. A couple days later, still not feeling good. Call again just to make sure. And the nurse on the phone was just super nice and just reassuring me that, I might be like on the last day of that antibiotic until I really start to feel better again. So I'm like, okay. So um, around that week, I would say like 11, might have been a Monday. I think it was like 11 weeks, 4 days. So, like the following week, we were able to find out the genetic results, which came back, as good as they can say. So, with the NIPS testing, the non invasive prenatal testing, they can't say like indefinitely these things, but our baby's not at an increased risk for Down syndrome, and whatever else they check for, trisomy 18 and something else. And we're having another girl. So, it was just really, I cried on the phone when the nurse told me. And I was just, I don't know. I kind of knew though. I knew we were having a girl, but I don't know. It felt really, I don't know how I would have felt either way. And sometimes, um, I feel like, well, if we were having a boy, could I have separated these two pregnancies in my mind better? Like with Josie, and I don't know. So Josie was our second baby. And anyway, so we are having a girl, and we've named her Nora. And it was so important to me, I think, early on to have a name for this child, because I just felt like if something happened, that was like another reason I wanted to really know the sex is I wanted to have a name for this baby regardless of what would happen. So anyway, so yeah, so that was really, really great. Um, so yeah, so then I finished the antibiotic around that time as well. And then 2 weeks later, or a week later, I don't remember, it like almost 13 weeks, I had an appointment with my regular OB. My husband was able to come. I asked for a urine culture, and they were kind of like, what? And I said, well, I just got off this antibiotic like last week, and I'm having flank pain still, and I'm having groin pain. And the nurse was like, well, it could be round ligament pain, like you're start going to be in your second trimester. I said, whoa, sorry guys. I said, well, it could be, but I want to check. So they were really cool. They did a urine culture. Guess what? Still bacteria in my urine. I was so pissed. So then they put me on amoxicillin for 10 days, and I just finished that. So that kind of took us to the end of the first trimester. That was like about right at 13 weeks. So hopefully, when I go back again, that amoxicillin, like, I just hope to God, it cleared everything up. I've been taking, after that fourth antibiotic, I was like, okay, I'm taking a pre and probiotic now. I have been since forever. I usually drink about a gallon of water a day, whether I'm pregnant or not. And just like making sure I'm like eating yogurt and eating, like, I put fresh cranberries in my smoothie, and I don't know. I don't know what else to do, guys. Cotton underwear and all that. So I feel like I've done everything I can. So we'll see at my next appointment what they find. Hopefully nothing. And it's just normal kind of from here on out. So one last thing I want to mention, kind of all throughout the first trimester, I mentioned this in the last video, is that I've had like cervical, vaginal, like sharp shooting, like lightning crotch that a lot of women would experience in their third trimester. Um, I've just kind of accepted that because every time I've brought it up or I've went in, everything has been fine. Like it hasn't seemed to be like indicative of anything negative happening. So I don't know if that's due to the TAC or not. Like I really don't know. I do know I have like scoured the Abby Loopers forum on their site, and there's a lot of women that have said that they've experienced that on and off throughout their whole pregnancy with the TAC. So perhaps that's it as well. So if you've experienced any of these things, I would definitely love to know in the comments below. I think that would be great to have others see your shared experience. It's a little less nerve-wracking when you can read or hear that somebody else is experiencing the same thing as you are. And pregnancy after loss is like so nerve-wracking anyway. So I think it's just reassuring to know that you're not the only one experiencing this, because your mind just goes crazy. So anyway, so that's it for the first trimester. I'm gonna make another video for the second trimester, and so you can click over to that when you're done with this. See you next time. Bye.